Hello, welcome to the Consortium of Universities for Global Health's Leader Interviews. I'm Dr. Keith Martin, the Executive Director of CUGH. Dramatic changes have taken place recently with regard to executive orders that have had a cataclysmic effect on global health here in the United States and around the world. None more so that have been affected is the U.S. Agency for International Development. Dramatic changes have taken place that have caused shuttering and indeed virtual closure of the agency that's vitally important to saving lives around the world. Shuttering the agency has had dramatic effects for people here in the United States, affecting thousands of individuals who are here and indeed in some of the lowest income countries around the world. To understand a little bit about the implications of this and what USAID does, I'm here and very honored to have Dr. Goosby here as our guest. Dr. Goosby, or Ambassador Goosby, was the UN Special Envoy on tuberculosis. He was also the US's Global AIDS Coordinator from 2009 to 2013. He led implementation of the President's Emergency Plan for AIDS Relief, also known as PEPFAR. Dr. Goosby is an American physician and infectious disease specialist, but importantly also, he was one of the world leaders and the first people to deal with the AIDS pandemic in San Francisco in the 1980s before we had antiretrovirals. So Dr. Goosby has incredible experience around the world. He's been on the front lines of caring for people and dealing with some of the most difficult international development issues worldwide. And we're very honored to have him here. Ambassador Goosby, thank you very much for joining us today on our leader interview.
Thanks, Keith Martin. Really wonderful opportunity to kind of put our heads together in these extraordinary times. So pleasure to be here.
Well, as I said in my own, thanks very much, Eric. And as I said in our own introductory comments, that you've had such a vast experience around the world dealing with complex medical problems, humanitarian problems, and political challenges. But perhaps let's step back a bit. Tell the audience a little bit about what is USAID, and what does it do?
Sure. USAID is an extraordinary agency in the United States government that has really focused on the elements of what people have termed soft power engagement in U.S. foreign policy. It is a concentration of technical expertise with both in-country expertise around the communities and individuals that make up those communities in terms of both the domestic civil society and the academic or government aspects of a country's ability to orchestrate a response. And I think USAID has had the technical elements concentrated in one spot with a funding line motor that was made available to countries at the country level. So US government taxpayer dollars going to federal, national level conduits at the country level in each of these countries to go to programs that would address needs from education to nutrition to every health need that you can name over the last 20 years. USAID has been the conduit through which the American people have been able to generate and deliver resources to help responses in country.
And it was created in 1961, and it had under President Kennedy, and it has had bipartisan support throughout a very long period of time. What did the government of the day, and why why was it created? What did they see in USAID to be of strategic advantage to the United States?
USAID really created the conduits through which the United States could come into a problem and make resources available to the individuals who are in front of the problem in any given country. So it brought external dollars from another country and made them available to a country in delivery systems and in systems that fed into the civil society and government systems of the country that we partnered with. It is a foreign aid relationship that every government has with another government in one form or another, and that can be big or small. The United States government took the issues around health and education as a focus of their soft power agenda, going back to post-World War II arrangements, really coming out of the Marshall Plan in Europe that followed the World War II kind of carnage that devastated most every country in Europe. The United States put a concerted investment strategy in rebuilding infrastructure that ultimately created educational, medical, and industrial infrastructure that was really the elements of civil society and not war machine related. So it transformed what had been war machine industry efforts into a peacetime economy that the populations needed in the way of civil society, et cetera.
And I think it's interesting you mentioned the Marshall Plan as a akin to USAID, because clearly both have and had a benefit to this country, because some people who are perhaps supporting this shuttering and attack on USAID are saying, why are we giving all this money to those people overseas? What are the benefits to USAID to the United States?
Yes, I don't want to oversimplify it, but USAID was able, in every instance where it generated resources and brought them to programs in other countries, it was trying to identify, I'd use the term threats that were possible that could come across the oceans and end up in the United States. I think in terms of infectious disease threats, so TB and HIV are the ones that most people are aware of. Both of those came out and started in countries that were not in the United States that we saw first and knew and had an opportunity to identify and engage that outbreak where it was occurring, as opposed to waiting for it to come to the US shores. So the United States, through USAID, was able to extend its ability to identify and contain threats abroad in a humane and appropriate way by a standard of care that is universally accepted, and give those resources and help deliver them to the populations that needed the most. Something
And I
the
think,
United States should be very proud of.
well, that honestly, Eric, is we both, my personal visits overseas, yours innumerable ones. One of the things I've always hoped that every American could see is the effect of USAID on the ground on people's lives. And actually, the very often courageous and exceptionally hardworking staff of USAID who work in often extremely difficult circumstances, resource poor circumstances, physically difficult circumstances to improve people's lives. Can you, just going back in your vast experience, maybe share with the audience some of the examples that you found, particularly in PEPFAR, because you've seen the impact of that program on millions of people's lives.
Yes, USAID truly is made up of some of the best people that I know. And I mean that sincerely. These are people that, where talk is cheap, actions speak louder than words, have decided to dedicate their life and the lives of their family to a service need, often thousands of miles offshore, not for a couple of weeks or a month or two, but often for 3, 5, 10 years or more. These are individuals like you see in the Foreign Service and the State Department, and that you see in the military, who have a lifestyle choice, have made a commitment to this lifestyle, living abroad, all the challenges that presents to a young family, a growing family, and a grown family. They do it all abroad, just as our military has to do, and all of the psychosocial stresses that puts on family unit integrity and their ability to raise their children successfully abroad is a different challenge than raising them in the United States. It also challenges that individual for their interpersonal relationships in ways that I've just been humbled by. The sacrifices that the individuals have to make are daily and real. Just as we see our military personnel make sacrifices, the families have to go along with this if it works well. And in the Foreign Service, Department, they all go, as the people in the embassy do, to move their families and residences to the countries in which they work. That becomes a critical commitment on part of USAID personnel to the people and the countries in which they're working. That gesture of comradeship, but also that I am willing to move my family and be in front of your problems and work with you to solve them, is a galvanizing aspect of USAID that I think is unique, that we really need to applaud and honor as we see this move forward. USAID, State Department, USAID itself, and the military really are the only ones who make that that type of sacrifice for such a sustained period of time. So just wanted to say that.
Yeah, no, excellent, Eric, because it's just it hurts. It hurts all of us in this space just to see how USAID staff and other staff are really being treated, abused, and scapegoated. Quite frank, in my view, in at this time. And as you said, they are some of America's finest people, and they are public servants, just like folks in the military, State Department, who serve this nation as unsung heroes all over the world. And I hope Americans really recognize that, because honestly, when I've been abroad, I said, I wish every American could see this.
I do too.
Frankly, right? And it's just, I
This
wish
is
we
a
could.
real contribution that is given
Yeah.
from kind of the basic substrate in year 1 and in year 10 and in year 20 in a way that really goes unacknowledged and largely unknown. But that commitment has generated goodwill on part of how America is viewed. When you look and go to places where America has a 23-year commitment to HIV, TB work in sub-Saharan Africa, Southeast Asia, these countries have a different perspective on what the United States is about, and as a result, have given us license to be in the decision-making process for their own populations in ways that they don't allow other bilateral relationships to play. And that's because the carnage that HIV represented to sub-Saharan Africa and many areas in Southeast Asia was complete. It saturated the hospital delivery systems so much so that they could not see hypertension, diabetes, or coronary artery disease. So people were dying from everything more, including HIV and TB, unable to access services. They died from heart attacks, strokes, lost their kidneys from lack of being able to treat high blood pressure. All of those morbidities have been stabilized and reversed with the partnering of the United States and other countries through the Global Fund, but the United States through PEPFAR, through its USAID conduits that have identified multinational partners that have created a program on ground that goes to 25 million people on just the HIV drug needs alone. 20 million people's lives saved a year is a statement that is supported by the USAID efforts in sub-Saharan Africa and Southeast Asia. A remarkable number.
I think if anybody was American who was abroad and whose family member had contracted a disease that was treatable and had access to it because of the United States of America, they would be incredibly grateful for that. And it was interesting. One of the arguments that people are tossing out, mythologies about why USAID should be gutted, is the issue of cost. And a little statistic I read that 31% of Americans, 31% of them think that USAID, that a very significant portion of Americans think that 31% of America's annual budget goes towards international development, which would make it something around $2 trillion. But in fact, that budget's about $40 billion, right? It's less than about 0.7%. 7 cents of every point 0.7, less than a penny of every dollars spent on aid.
No, Keith, it's a remarkable misconception that is universally held by everybody. And when you go to European countries, they have the same disconnect. They think their governments are spending inordinate amounts of money on foreign aid, when in actual fact, it's less than 1%. And it is a huge positive for the investment incurred. So the benefits we reap from that small investment are huge, and they're even larger potential that we could, take it further advantage of. But keeping HIV and TB offshore, nobody has seen an Ebola outbreak in the United States, and there are reasons for that. And the reason is that we meet the organism where it broke out in the country of origin and try to contain it in that setting, and are good at it, have gotten better at it. And I think that relationship needs to be continued. So USAID was and continues to be the strongest conduit to move those resources to make program happen where it's needed, when it's needed.
And strengthens you. It's a really tiny, as you said, tiny investment for the rate of return if one wants to simply look at it in those ways. It was interesting that those that were cheering on the dismantling of USAID were Russia, Hungary, and El Salvador. And part of the reason for that is our other programs that USAID funds in terms of anti-corruption work, public oversight of expenditures, and it really prevents corruption from being able to infect governments. And USAID is investing in strengthening the ability of the people to ensure that their taxpayers' dollars are being used wisely and effectively. Can you speak to some of the other programs, Eric, that USAID funds overseas?
USAID has focused on trying to look at what are the essential motors in civil society that make the population educated, able to participate in the politics of their country, and respond to the kind of needs of the population that go from scientific needs to doctors, nurses, and medical technical people, to sociologists, to professors of philosophy and English education, all the entire gamut of what a university really needs to offer its population for it to thrive. Once you create a civil society that holds an expectation for a standard of educational access and its health care, you create an expectation in that civil society that begins to hold the politicians accountable for delivering that every year. And what this support has done through USAID type activity is strengthen civil society to be the voice that holds our governments in place and accountable to continue to identify and respond to the needs of the population. I think without that voice, the government goes where it wants to go. And I would say I've seen over and over again the health-related infusion of resources that builds a cadre of dialogue and support in an HIV or TB arena, creates a subset of individuals that are functional in talking to government about the other needs of the healthcare delivery system and educational systems for their population. So you create capability in both expanding the dialogue and visibility, transparency, holding people accountable, which is moving a strong democratic theme throughout the world.
And that being that, as you mentioned, that democratic theme is fundamental to a functional democracy and state stability that we sometimes take for granted. So it leads to the next question, Eric, and that is, there's a cost to leaving the arena, so to speak, that if USAID is shuttered and shuttered overseas, it creates a vacuum that other actors can actually occupy, actors that may not have the best interests of the United States at heart. Can you speak to that?
I think you're right to say that it creates a vacuum, and that those who have an agenda that they can exploit, they will take advantage of it without a doubt and move into that vacuum to fill it with their needs. And I think that we see that really in every country we work in. Our ability to call foul and to say that this is not appropriate, that it's inappropriate and needs to stop, requires a civil society that is empowered and not afraid to push against the authorities within their own countries' relationships. And that is variable from one country to another. But it always gets stronger when civil society is empowered with the ability to convene and talk about the response of the delivery system, like in HIV or in TB, that they are already paying for. The assessment of how well it's doing creates a dialogue in society about investment, outcome, output, and the return on investment being acceptable or not acceptable to the people who depend and use those services. So the people in the clinics and hospital systems themselves being able to talk to the system and say that did or did not work in year one. So in year two, a budget adjustment is possible. And the USAID infrastructure and systems they created allowed for that local propagation of dialogue that took ownership of where the program was going and ultimately strengthened the government's ability to not only to know what the right thing to do was, and being able to cipher that out has been difficult in any government. And that I would say that local inclusion in planning and in defining unmet need and in prioritizing that unmet need creates the dialogue that's needed for the corrective elements to be teased out and part of the solution.
And that technical advice that USAID has provided, Eric, is fundamentally important to enabling countries to be able to be self-sufficient and to strengthen their own systems. And USAID has played a fundamental role in that. Gets out of that, states become less stable and less effective in delivering programs. And as a result of that, would it not be fair to say that the global community becomes less stable and USA becomes more vulnerable and less secure by what could happen overseas when states start to become less stable?
Yes. Having a receding line of support that pulls the program elements look more vulnerable, become less robust, actually decrease in their ability to respond to the unmet need and wane in the delivery system that was built. That hiatus, that uninterest, as the U.S. government pulls away, as momentarily as that may be, or transiently as that may be, the pulling away of USG resources will cause a dip, a deceleration in the ability to put and keep program on ground. And when you're dealing with life-saving programs, and I mean, you're dealing with diseases that kill people when not responded to, the death rates go up within days to weeks. So we're looking in a 90-day hiatus. We're looking at, we will be able to see differences in number of children who are born HIV positive who would not have been, number of people will die who would not have died in that same time period. We will be able to actually look at the number differences as they continue to go back up. And that is a tragedy for the individual whose disease progresses in them, but also in the population where the disease moves differently through the population because of the lack of the ability of the program to put and obstruct movement of the virus into different high-risk groups. It's gotten that sophisticated with HIV and TB, where we're trying to get in front of that movement and are successful at it when it's engaged. But as soon as you stop doing it, you see a rekindling of that movement right back into the population, and away we go. So the gains won will be lost the longer we stay unengaged in maintaining and expanding the delivery system that, in the case of HIV, in many of these countries, we have built and stood up for 23 years. So to see that wane will be tragic.
And I think to your point that Eric, that a lot of, I hope, well, the people who are supporting this need to understand that shuttering the programs and flipping the switch so cavalierly has signed the death sentence of people around the world. There are people who are dying now and will die over the next 90 days, as you said, who would not have died if not for this pause that have just been inflicted by the incoming administration. So they've literally signed the death warrant of innocent people, and those to those who frankly in the in who may have very strong religious beliefs, who support
Mhm.
the government and may have strong religious beliefs that they hold dear to them, which is great. This runs completely counter to that, and I don't know if that's a sensitive issue to talk about, but I hope people look into their hearts and see that that's exactly what is happening to innocent people around the world.
Completely right, Keith. As physicians, as nurses, as health professionals, we take an oath that motivates us every day to get up and do it again. And the main output that we're looking at is our ability to see the results of that labor have resulted in fewer people seroconverting with HIV, becoming positive with TB, and progressing in that disease and inevitably dying from it. Those differences are something that were hard won, but easily lost. And I would also say, just as tragically, easily maintained if we continue a modicum of support to the programs and allow the people who have been trained to deliver these services in country to continue to allow that indirect support to continue. So we get and secure the legacy that these programs really have already bought, and would be tragic to now abdicate.
Yeah. And it includes our relationship and presence, the presence of the United States and a lot of multilateral agencies like the WHO. Evicting the terrain on those will have devastating impacts upon people around the world.
No, I'm embarrassed that we hadn't kind of brought that up earlier. You're right. To move away from a multilateral arm takes away one of our main conduits to get in front of a pandemic threat. So when it's not in your country, but it's in someone else's country, not on your border, but a couple of countries over, what is your ability to harness that country's resources, grab them and get them in front of where and how that virus is moving into their population? We know how to do that intellectually, scientifically, but the ability to do it requires resources and delivery systems that allow for those resources to go to program. And that has all been built. And now every day, week, month that we don't fund these programs, those relationships get dismantled. Procurement distribution systems weaken, don't happen, and a week off of a delivery, non-delivery relationship going for naught, that delivery system will not be remembered by that system again until you come back in and force it to do it. And I've seen that really hundreds of times in US and in resource poor country settings, one after the other. The persistent stability is precious and delicate. Once removed, the system remembers how not to do it immediately.
Yeah.
So
Easy to break,
easy to
tough
remember.
to rebuild, right?
Yeah.
So in our closing comments, Eric, can you provide any suggestions to the global health community what we can do to assert, perhaps, to change this to the American people? What are the sort of key messages that we should be delivering to the American people about the shuttering of USAID?
Yeah, I think the tragedy that it represents, the potential for loss is a crescendo. It's a growing potential. The loss is immediate, but it gets worse as you delay funding or support. And I think that the commitment that we have made to these countries will be for naught, and we will be abandoning the people and patients who depend on these services by stepping away from it in this way. We should not have an abandonment of care relationship fostered, but it should be a transfer of care to the countries and to the delivery system of the country. And we should be present as that transition occurs so we don't see people lost in the transfer, lost to follow up, who never benefit, 2-3 weeks down the road. This needs to be a seamless transfer. We're smart enough to do it, and we need to do it now.
Thank you very much, Eric. It's been an honor for you to be on our CUGH leader interview. Ambassador Eric Goosby, the former head of PEPFAR, and many other important roles for the United States. And I think, Eric, you have provided us with a cogent, sensitive, moral, realistic defense of USAID in the interest of the United States, in the interest of the American people, and in the interest of the world and some of the most vulnerable populations. As you said, the program, the people who work at USAID are American heroes, work tirelessly for the good of this country and the world, and USAID is an indispensable tool for America, for the American people, that makes this country healthier, more prosperous, and stronger. To dismantle it does the exact opposite. Dr. Goosby, thank you very much for being here today, and thank you to all of you for joining us on the CUGH Leader Interview.